Millions of T cells circulate in the body, and each recognizes a unique antigen through its T cell receptor.
T cells mature in the thymus. B cells mature in the bone marrow.
That's why these are called T cells and B cells.
T cells only recognize peptide antigens. Polysaccharides cannot be recognized by T cells. Only amino acids and protein-derived peptides are recognized. T cells only recognize antigens when they are presented by antigen-presenting cells.
The T cell receptor is composed of one alpha chain and one beta chain, surrounded by the CD3 complex.
CD3 transmits signals after antigen recognition. This allows the T cell to become activated and attached to the antigen-presenting cell. CD4 and CD8. CD4 T cells, also called helper T cells, produce cytokines and activate other immune cells. They direct the immune response. MHC Class II binds to the T cell receptor, or TCR, and the CD4 co-receptor. It is expressed only on antigen-presenting cells, also known as APCs. MHC Class II is made up of 2 alpha chains and 2 beta chains. These chains are protein molecules that form the structure responsible for presenting antigens to helper T cells.
MHC Class II gets an antigen and moves to the surface of the antigen-presenting cell. It then attaches to helper T cells to initiate the adaptive immune response. This MHC Class II molecule carries the invariant chain, and together they move into the fused phagosome and lysosome, where antigen processing continues. As it gets inside, the invariant chain is destroyed, and MHC2-Phi can bind to that smaller peptide, the antigen.
MHC2-Is goes onto the surface of the APC, the macrophage, having that peptide fragment, and is now capable of reacting with T cells.
CD4 T cells require more than one stimulation in order to get fully activated. This process is called co-stimulation.
There is B7 protein on APC that binds CD28 on CD4 T cells. MHC2I binds to T cell receptors. CD4 binds T cell receptors and MHC2 both. B7 binds to CD28. This co-stimulation is important, so T cells do not get overactivated and damage normal cells or cause autoimmune diseases. Stimulate B cells, so they produce more antibodies. Stimulate CD8 T cells. Activate macrophages. There are 2 types of CD4 T cells, Th1 and Th2 cells. Th1 cells. They cause cell-mediated immune responses. They activate CD8 T cells and macrophages. They activate CD8 T cells and macrophages. Th1 also promotes production of Ig antibodies for activation of complement system. Important info. Th1 is very important for intracellular infections, like M. tuberculosis. MTB can hide inside of macrophages. Antibodies can't get in there, so we need strong Th1 response. Listeria. We need strong response for listeria. Th2 cells, humoral immunity. Activate B cells to lose to produce antibodies, mainly IgE and IgA. Cytokines released by Th1 and Thra2 cells. H1 cytokines. IL-12 gamma inhibits H1, inhibits H2, and causes production of IgG and increase MHC expression. H2 cytokines. IL-4 enhance the production of THR2 and production of IgE and IgG. IL-13, BFG4 help. IL-10 inhibits THAF1. It produces an anti-inflammatory response and inhibits macrophages. IL-5. I have 5 BAE. B cell producing IgA and Ig. But newborn and elderly patients have greater risk for listeria because they have weak Th1 response. In pregnancy, T helper 1 response is decreased to protect the fetus. So pregnant women are at greater risk for listeria and can pass listeria to fetus. This condition is called granulomatosis infantiseptica. In general, granulomas are formed by macrophages. Macrophages develop into giant cells that are hallmark of granuloma. In tuberculosis, Th1 cells secrete interferon gamma that activates macrophages. This contributes in development of granuloma. Macrophages, in addition, secretes TNF-alpha that promotes granuloma formation. Th1 cells release IFN gamma that stimulates macrophages. Macrophages release IL-12 that causes Th1 production. Rarely, children can born defect of any of these, IFN gamma and IL-12. IL-12 receptor deficiency. If IL-12 do not has receptors on T cells can't differentiate into THAF1 cells. It means there is less or no production of Th1 cells that produce IFN gamma to activate macrophages. So there is less activation of macrophages. So low Th1 and low IFN gamma. Risk of diseases due to low Th and IFN gamma include mycobacterial infections, i.e. TB, and disseminated salmonella. These children
BCG, vaccination for TB. So we treat these children's IFN gamma. IFN gamma will activate macrophages to fight against infections.
IFN gamma receptors deficiency. These children's cells do not have receptors for IFN gamma on macrophages. Diseases related to it. Mycobacterial diseases, i.e. TB. Salmonella infections. IFN gamma is not effective in it because of receptor deficiency. Continuous antimycobacterial therapy. Stem cell transplant to restore receptors.